This is Rachel with Consumers for Affordable Healthcare. We know that health insurance can be complicated. We are here to share a few common health insurance terms and examples of documents that will help you understand how your insurance works. Consumers for Affordable Healthcare is Maine's health insurance consumer assistance program. We help consumers and professionals. We screen consumers for eligibility for Maine Care and Marketplace coverage and help them apply. We offer guidance and sometimes take on private insurance appeals when a consumer's medical care has been denied. We help professionals through workshops and trainings such as this one. Common health insurance terms. Premium. This is the amount you pay every month to have health insurance. You pay your premium even if you reach your out-of-pocket maximum. Copay. Your copay is a fixed dollar amount you pay for services, like a visit with your primary care doctor or specialist doctor, or for prescription medications. Copays do not count towards your deductible. Deductible. This is the amount you pay for health care before the health insurance company pays. Some services go towards your deductible first. Depending on your plan, you may have multiple deductibles. Deductibles are either per person or individual and family. Also, you may have separate in-network and out-of-network deductibles. Coinsurance. These are healthcare costs that are shared with the insurance company. Coinsurance is a percentage of the overall medical bill that you have to pay. Depending on your plan, it can be 20, 30, 40, or 50% of a billed service. Coinsurance payments continue even after you meet your deductible, but stop when you meet your out-of-pocket maximum. Out-of-pocket maximum. This is the most you will pay for your healthcare during the plan year. Costs over the maximum are paid by your insurance. Deductibles, co-payments, coinsurance all count towards the out-of-pocket maximum. Once you have met the out-of-pocket, your insurance pays everything except your premium. Depending on your plan, you may have separate out-of-pocket maximums for in-network and out-of-network services. Allowable amount or contracted rate. The allowable amount is a discounted rate you get for being a member of your health plan. It is the amount your insurance company agreed to pay your provider for a service. Provider networks. The list of doctors and hospitals your insurance company agrees to work with. Insurance companies contract with doctors and hospitals, who then become part of that provider network. If you see a doctor or use a hospital that is not in-network, your insurance company may not pay for those services. Prior authorization. This is a request by your prescribing doctor asking your health plan to cover care, a procedure, or medication. If a prior authorization is required and is not granted, the service will not be covered. HMO versus PPO. You may have heard the terms HMO or PPO. Health maintenance organizations have narrower provider networks, and your primary care doctor must be in network. Referrals are needed to see specialists, and the specialists need to be in network. For care needed outside of the network, prior authorization from the insurance company is required. If you do not get a referral from your primary care doctor for a specialist, the specialist visit will not be covered. Preferred provider organizations are a little broader. Your primary care provider should be in network for the lowest cost. Referrals are not needed to see a specialist, and the specialist can be out of network. Both HMOs and PPOs cover out-of-network emergency care. Prior authorization should be obtained for out-of-network care beyond the emergency. Tiered provider networks. Some health plans have tiered provider networks. Preferred tier care costs less than standard or non-preferred care. On the left, you'll see a two-tiered network plan displayed like this, as shown in a summary of benefits and coverage documents. You can see Tier 1 care is less than Tier 2 care. On the right, you will see an example of how tiered plans may impact your out-of-pocket maximums. Site of service provider. This is a provider of certain services, such as imaging or laboratory, that agreed to work with your health insurance. You will have a copay when you use this provider for imaging services like x-rays or lab work like blood tests. You can still get these services with other providers, but the cost may be applied to your deductible and cost more. Common health insurance documents. Drug list or formulary is a list of medications your insurance plan will pay for. If you use or are prescribed medications, check your plan's list to see if they are covered. The formulary will tell you what drug tier the medication is in, for example, generic or tier 1, generic or brand name, etc. The formula also tells you if the medication requires prior authorization, step therapy, or if there is a quantity limit. Prior authorization is a request by your prescribing doctor asking your health plan to cover the medication. Step therapy requires you to use a lower cost drug first to see if it works. If it doesn't, then the plan may cover the higher drug cost. A quantity limit refers to the highest amount of a particular medication the insurance company will cover within a certain time frame. The formulary will also tell you if your cost for a certain drug is less if your plan's mail order pharmacy is used. To find your plan's formulary, check in your health insurance member portal or call your health insurance company asking for a copy of your drug plan list. Summary of benefits and coverage. Health plans provide a summary of benefits and coverage document that goes over the plan's associated costs. Typically, your insurance company makes these documents available through your online member portal. You can also call your carrier to request a copy. The summary of benefits and coverage shows the plan's deductible, the plan's out-of-pocket limit, copays for primary care and or specialist visits, how diagnostic tests and imaging are covered, how emergency room visits are covered, how urgent walk-in care is covered, how hospital stays are covered, how outpatient surgery is covered, and how prescription medications are covered. Here's an example of a summary of benefits document. The summary of benefits document is, as you can see, a snapshot of your plan and describes deductibles, copays, coinsurance, and out-of-pocket amounts. On this example page of the summary of benefits, you can see information that will help you understand how you are responsible for healthcare costs for various services in different tiers. The certificate of coverage. This is the contract between you and your health insurance company. This document can be 50 or more pages long. Typically, your insurance company makes the certificate of coverage available through your online member portal. You can also call your carrier to request a copy. It tells you how your coverage works, what is covered, what is not covered, how claims are paid, what to do if your medical care is denied, your appeal rights, and other pertinent information. Explanation of benefits. This is the document your insurance company sends to you after it has processed a claim for medical care. Explanations of benefits can be mailed to you, or you can access them through the health insurance plan's online portal. The EOB tells you how your claim is processed, the amount a provider agreed to be paid by your insurance, the amount counting towards your out-of-pocket limit, the copay, if any, you owe your providers, how much, if any, that went towards your plan's deductible, the amount of coinsurance you owed if you have met your deductible but not the out-of-pocket limit, and if your claim is denied and the reason why. In this example of an explanation of benefits document, you can see the date that the service was provided, the name of the provider, the date the claim was paid, the service that was provided, the amount that was billed, the amount the plan allowed, the amount the plan ultimately paid, your responsibility, any copays that were due, any coinsurance that was due, and the amount that was put towards your deductible. You can also see the claim codes listed. Consumers for Affordable Healthcare understands that health insurance coverage is complicated. You can call Maine's Health Insurance Consumer Assistance Program for help understanding your coverage. Our helpline is available Monday through Friday from 8:30 to 4:30. Thank you so much for watching.